Good morning, good afternoon, good evening. Welcome to Nose Creek Sport Physiotherapy video blog. And today's topic is passive range of motion. So these are 3 things that you guys can do at home to get your range of motion back in your shoulder if you've had a shoulder injury, or if you just plain old gotten a painful stiff shoulder that's not moving. The first step in recovering from a shoulder injury is to make sure that you get your range of motion back. So the first thing we like to do is what we call a pendular exercise. So we're gonna get down almost like a football lineman stance. I'm gonna put my elbows right on my thighs. I'm going to hang my arm down, okay? Thumb points above my head. I do small circles, okay? Getting bigger and bigger, and oval shaped circles kind of side to side. Don't go way up here because I'll tend to pinch the sore tendons. So just kind of nice and slow. Just let the arm hang down like a dead weight. And just nice and easy. You do 10 this way, and then 10 the other way. And start small, like the size of a silver dollar, and then just slowly getting bigger and bigger and bigger until you hit the range that you're sort of comfortable with. And the rule with passive range of motion is always do minimum 10, but work your way up to 30 repetitions if you can. So if it's painful on the first day, just do 10, but every day try to add a couple repetitions and get up to like 30 motions if you can with these movements, okay? The next thing we'd like to do is take a stick. Now this can be a broom handle, a hockey stick, a golf club, whatever you guys have at home. I've just taken PVC pipe here in the clinic and cut it into 2-foot lengths. And then, so I'm just gonna lay down on the bed here, and Belle's gonna swing around. We're gonna take a picture of how to do kind of external rotation. So I'm gonna lay down here. Come on over, Belle. There we go. And so what I'm gonna do is I'm gonna lay down, I'm gonna keep my elbows tucked at my side, and then just very gently I'm gonna over press into external rotation. I'm gonna hold there for about 3 seconds, and then go the other way, and then press, and then hold there for 3 seconds. Now I've got full range of motion. A lot of you won't be able to go right to end range, but that would be end range. Your forearm should be horizontal if you've got kind of a shoulder that's coming back into normal. So for me, this is my good shoulder. I can go all the way there. For my right one, I get about there and I start to get symptoms. So the key when you're doing this one is to keep it within your comfort zone. So you just want to go to where you feel a little bit of soreness and a stretch in the front of the shoulder. You don't want to push to where you're getting like a sharp pain. So it should be just a gentle sort of stretch in the shoulder. Okay, and again, start with 10, work your way up to 30. Always do heat as well if you can on that shoulder before you do passive range of motion. And then at the end, if it's sore from doing the passive range of motion, then what we want to do is put ice on it to reduce the pain and also to stop any inflammatory reaction or swelling reaction in the tendons in that darn bursa sac. Okay, and the third thing, my favorite exercise for passive range of motion is the pulleys. So we're just going to pop down here in this section of the clinic here to our functional station, and we have a pulley here. So you can buy one of these. If you don't have one, come to the clinic and pick one up. You're going to sit the chair in front of an office or a table. Oh, and by the way, this little rubber part here, you can see here, you can see that belt, that goes behind the door, okay? So it catches between the door and the door frame. Here in the office, we just have it looped around there. But then you would close the door, and it catches on the other side between the door frame and the door. Then you're going to lock your arm on the affected side and then pull down with the bent arm on the other side, just till you feel a gentle stretch at the top. 1, 2, 3, and then down slow. And then you can do the other arm while you're there. 1, 2, 3, and then down slow. And you want to repeat again, 10 to start with, and then 30 is your goal as you're starting to feel better. Okay? So just work on getting this. Once this is full and pain-free, quite often what we'll tell our patients is, okay, you've got good range there. Let's go halfway out to the side now. Let's start working that range, sort of 10 times there, and then coming down, sort of working 10 times there. And then after a couple weeks, if that's full and pain-free, then you can actually start working out to the side, all the way out to the side, and then pulling up, and then down slow, and then you can sort of work the other arm up as far as you can, and then down slow. But really for the first while, just focus on the flexion or the forward motion if you can. That's the most important one to sort of get comfortable with first. All right. So there you go, folks. Just a quick review. So today we did passive range motion. We did the pendular exercise, bent over like a football lineman, slowly moving our arm into circles 10 times each way, working up to 30. Then we grabbed our football, or stick rather, and we just went back and forth 10 to 30 times. And we have our pulley set up here. And again, 10 to 30 times with that as well. So those 3 movements, if done twice a day, should increase your range of motion over the next sort of 4 to 6 weeks. Okay? And if you don't have a pulley, just pop by the office and get one for Belle and start getting that shoulder moving. For patients over 60, after they have a shoulder injury, I usually tell them, keep doing your pulleys just once in the morning to loosen up that stiff shoulder for the rest of your life, just to keep the shoulder supple and mobile and pain-free. All right? So I hope that helps, and we'll work hard at that at home, and I'll see you guys soon. Take care. Bye-bye.